We know that people are dying, and they're dying untimely deaths because they're actually taking drugs that are contaminated with fentanyl and other toxic substances.
It could be the solution to Toronto's opioid overdose crisis. The city's medical officer of health is making a controversial recommendation to decriminalize all drugs.
As an addict, we're not all bad people. Not all drugs are bad things if used properly. We're all put under an umbrella that we're all bad people, and that's not true. Given a chance, I think a lot of us can be very successful.
For Stephanie King, who says she's been an addict for over 30 years, today's Toronto Public Health Report is a next step in addressing the epidemic. The city's medical officer of health says the current drug policy approach just isn't working, and the numbers prove it. In 2017, there were 303 opioid overdose deaths in Toronto, a 63% increase from the year before. A report will be going to the Board of Health next Monday, recommending that the city take a public health approach to drugs and push the federal government to decriminalize the possession of all drugs for personal use.
The criminalization of drug use increases stigma associated with the drug use. So what happens then is that people are forced into unsafe practices, and they're also less likely to seek out help. What we're talking about is taking away criminal penalties associated with drug use for personal use, right? Not drug use for selling purposes or trafficking purposes.
Would decriminalization address the opioid crisis in Toronto?
Well, I think it would certainly go part of the way or a long way towards helping that. We do have a significant opioid overdose emergency that's happening here in our city.
So what led to this recommendation? Last year, TPH set out to consult members of the public through surveys, community sessions, and interviews on the drug policy. According to Public Health, 3/4 of respondents say it needs to be changed, and a majority were in favor of this public health approach that would also focus on harm reduction, prevention, and treatment. The reviews in Toronto are mixed.
I would have concern. I already think that there's a big drug problem on the streets of Toronto already. I'm not certain that it would work.
I think if you understood drug addicts and what they're about and why they use, I think things would be much different.
Toronto Public Health is also recommending the creation of a task force made up of diverse voices, including experts and people who do use drugs. And this group will explore the legal regulation of all drugs in Canada from the perspective of a public health approach. For City News, I'm Faiza Amin.